But this next story is going to be of interest to all of you, especially all of us with kids between the ages 5 to 11, as Pfizer has asked the U.S. government to allow the use of its COVID-19 vaccines in children within that age group. And if regulators agree, shots could begin within a matter of weeks.
Advisors to the FDA will publicly deliberate Pfizer's vaccine in the 5 to 11 age group on October 26, setting the stage for the FDA to declare if the shots are safe and effective for those youngsters.
Okay, you ready? 1, 2, 3, ready?
On Tuesday, Pfizer and BioNTech announced that they had submitted an emergency request to the U.S. Food and Drug Administration for authorization of the company's 2-dose COVID-19 vaccine in children ages 5 to 11.
Okay, I think I see it right there.
I was kind of nervous at first, like any shot, basically. And it did hurt when they put it in, but after about 2 days, the pain just went away. It makes me very happy that I'm helping other kids get the vaccine, and honestly, if I had to get the shot again, I would. Honestly, I would. If you don't want to get the vaccine, just don't be scared. If you get it, you can help others.
Many parents and pediatricians are clamoring for protection for children younger than 12. Not only can youngsters sometimes get seriously ill, but keeping them in school can be challenging with the coronavirus still ranging in poorly vaccinated communities.
I had breast cancer 4 years ago, and I know that clinical trials saved my life, and the life-saving drugs that women, a decade or two ago went through, and things just like this, where they really weren't sure of the outcome. I think I'm very proud of him, and he knows my history, and he went through that with me. They're not little adults, they're little humans, and we do want to make sure that it is absolutely safe for them. But I will be overjoyed when it happens.
Now, the Food and Drug Administration will have to decide if there's enough evidence that the shots will work for younger children as they do for teens and adults. Advisors to the FDA will publicly deliberate Pfizer's vaccine in the 5 to 11 age group on October 26, setting the stage for the FDA to declare if the shots are safe and effective for those youngsters.
Now, won't you say that Sebastian is a very brave boy? He's just so cute. And of course, him being one of those that have been in trial. Now, Pfizer has released details of the phase of third trial that showed its COVID-19 vaccine was safe and generated a robust antibody response in children from ages 5 to 11. So the trial included Sebastian and his other friends of 2,268 participants ages on that age group, and used a 2-dose regimen of vaccine administered 21 days apart. Now, the trial used a 10 microgram dose, so smaller than the 30 microgram dose that have been used for us and 12 kids and older. So Dr. Sanjay Gupta had stated that the symptom will be lessened, because usually when the adults get it, you'll get some kind of when they got the shot and whatnot, you kind of feel that it's kind of like numb and whatnot. Some probably got other symptoms. Now, because of the microgram dose is more or less, then it's more or less symptomatic for those who are going to get the jab. Now, children are really become ill due to COVID, but because of the Delta variant, for U.S. alone had drove nearly 30,000 of the children in hospitals in August. And according to the American Academy for Pediatrician, nearly 5.9 million Americans younger than 18 have been infected with the coronavirus. So roughly, there's about 500 American children under 18 who have died. About 125 of them were children ages 5 to 11 years.
Wow.
So why are this age group now has been the focus of the vaccination? First, face-to-face learning has begun.
Yes.
Second, Northern Hemisphere countries, now they're going in from fall to winter. So we know what happened, right, for coronavirus or this COVID-19 pandemic during the winter times. And the third, it is nearly the end of year holiday. The kids has not been meeting with the grandparents for about, what, now 2 years? It is time for them to meet with their grandparents, senior citizens and whatnot. So this is why this age group is very important to be vaccinated. Now we're just waiting for the trials. It's going to be within weeks, and we're going to know what's going to happen.
Right, even if you roll it out at this time, you'll only barely make it in time for Christmas and New Year's in a couple months.
They said the vaccine could be ready for rollout as early as November. So
Yes.
this is good news for you guys, because your children are in that age group, right?
Yes, I'm one of them.